Good day, everyone. Good day. My name is Rosalind Young Daniels, and I'm president and founder of Black Health Matters. Again, thank you so much for joining us for this impactful global summit. I just can't talk to you enough about the level of participation and collaboration that we had with our partners. And today we're going to actually have an opportunity to have you meet one of the key people who were on our steering committee, and that is Dawn Carr, and she helped to curate this panel that we're going to have this afternoon. Before we start, I again would like to thank GlaxoSmithKline for their support of this amazing conference. We are dialoguing and building new relationships with people of the diaspora, and we could not have done it without GlaxoSmithKline, so we do thank them for their wonderful support. Now, we're going to have a great conversation between two colleagues that know each other and work for the benefit of humanity as they fight for health equity. The name of this session is A Community Response, Mobile Health Outreach. And again, this was curated by Dawn Carr and Gary Steward. If you give me just a second, I'm going to tell you a little bit about Dawn Carr. What I know about this wonderful woman is that she has a passion for service. So just in the few months that I've been able to meet with her and for us to plan the Black Health Matters Global Summit, she has great energy and commitment to helping uplift our community. And our community means the global community of the diaspora. Dawn is a leading fixed-term project person who is with UCAN Birmingham, otherwise known as This Is My City, which is a food, arts, sports, and cultural program. It runs in the Birmingham 2020 Commonwealth Games. Dawn has a proven track record of leading and developing projects focused on Black and minority ethnic groups at local and national levels. She started as a caseworker for Birmingham Racial Attacks Monitoring Unit and has been very instrumental in working on cases such as that of Mickey Powell, who would be the Birmingham equivalent of George Floyd. Dawn has also worked at the Commission for Racial Equality, a funding officer for improving reach at capacity builders, and Equality Performance Officer at Legal Services Commission. Gary Steward is a managing director of Black Heritage Walks Network. Gary has worked as a Black Heritage consultant on a wide-ranging project across the UK. He created Recognize as a platform to deliver Black history community projects and has been operating for 12 years. He has worked on many endeavors, including regional project coordinator for screening of Hero, an independent film about the extraordinary life and times of Ulrich Cross. So I'm grateful and I am humbled to welcome both Dawn and Gary to the Black Health Matters Virtual Summit.
Thank you.
Thank you. Thanks for having us.
So tell us again about your organization and your collaboration and again, how this has fueled everything that we're seeing, touching, and hearing today.
Do I go first?
Of
Yes,
course,
go ahead,
ladies
Dawn.
first. Where's my manager?
Okay. All right. So, as you know, I'm the outreach lead for UCAN Birmingham. The UCAN United Community Activity Network is what we call an anchor organisation. So this is an organisation that supports many different member organisations within Birmingham. And the aim is to strengthen communities and obviously tackle the disadvantages within the Birmingham area. Now, prior to COVID, we already identified that there was inequalities in health within the Black community. And as a result of that, we already, this is prior to COVID, linked with local academics, local sports organisations, local community groups and foundations to raise awareness of these health inequalities, but also to put together a solution-focused program, which is called This Is My City. So I lead on the This Is My City program, which is a 4-part scheme that focuses on innovation around food, innovation around sport, innovation around arts and cultural awareness, and most importantly, health outreach. And our aim is to showcase the best practice that's in Birmingham, but also to discover new approaches to support the health inequalities and all the challenges for the minority communities in Birmingham.
Awesome, awesome. You know, that's very interesting. I mean, at Black Health Matters, we too understand that to talk about health and wellness, it just can't be from one side or has to be from another side. You really need a full ecosystem to be able to do that and to leverage the
Absolutely.
power and the voices of churches and organizations. So we too believe in that as a methodology for improving health outcomes. Now, Gary, describe your organization and its core activities.
Okay, well, I'm not sure how I follow on from Dawn with such a wide breadth of background, but I'll try my best as well. So I'm the Managing Director of Black Heritage Walks Network. We're a community organisation that was set up. It's sometimes the simplest solutions are the best ones. And how we came about looking at inequalities, but looking at how do we tackle the solution within our own city. Birmingham as a city, it's one of the most, diverse cities, the largest African Caribbean community outside of London. And as with all cities, we have a large inequality within the city, within the health system as well.
Gary, can I just ask, what does that, what percentage would you say that is?
I'll pull that up for you because I've got that as some information I want to give to you later, if that's okay. Can I come back to that? Yeah. And the reason why I wanted to talk about that as well is we look at the usual, we talk about inequalities. The Black community, as an academic point, is actually researched, one of the most heavily researched communities. So what we're talking about here today isn't new. It's not new research in some cases. It's stuff that we've known. We've always known that we've suffered through these inequalities. COVID helped to actually highlight that, but it wasn't telling us anything we weren't aware of before. And that's where our organisation, Black Heritage Walks, was actually co-created as a response to trying to create solutions without them being multi-million-pound solutions. How do we create small, low-cost solutions that can be quick wins, quick fixes as well? And what that led to was our organisation tackling 2 issues, which was one about health, people getting out and walking. We slipped into that heritage that people had something to do on the walks instead of just trying to convince people to go out on a walk, which is quite simple. And then the third thing that we did as well, we looked at mental health and we tied in mental health into the inequality of walking and looking at those sort of conditions that we're aware of, diabetes, high blood pressure, 2 of the issues that affect the Black community quite strongly as well.
Awesome. So I have to follow up. So in terms of what we know is that exercise and movement are just kind of like a therapy unto themselves. The more you move, you'll feel better, you'll look better. And that's interesting that you're also, not only are you encouraging people to get out and be more active and walk, take advantage of the air, sunshine, all of that, but I guess you're also, when you say heritage, can you speak to what that means to the person who's walking and participating in your program?
Yeah, so in our city in particular, we have a bit of an issue at the moment where our sort of contribution to the city isn't recognised in its full entirety. We have a city with a population of nearly 1 million as well. And if you don't go into particular quarters of the city, you wouldn't understand the makeup of it. Those lead to the inequalities that we're talking about in the city. So let me give you an example to break that down for you as well. One of our walks is in an area called Handsworth, very, very deprived area, very inequalities, social issues, social inclusion, all those sort of issues that we're used to seeing with deprived areas as well. But it's also for us as the African Caribbean community, it's where a lot of our people, when they came here, migrated here in 1948, it's an area that they settled out of destination and also to keep together with part of the community. Now, for us, it's like got a steep in heritage. You walk down the high street, you'll see many people, elders from the community who came here that are settled here as well. And what we're trying to do is put that on the map for people to understand and keep this heritage because it forms part of our identity. Am I right? So, if we let the city talk down our identity, talk down the reasons and being for our inequalities in these particular areas, and also why this systematic this systematic inclusion allows them to sort of continue this story of inequalities in the area. We're never going to change that story or perception. So what we've tried to do is give people an understanding the city that they're attached to. We do walks around the place. We've been to other cities as well. And I remember one guy from Liverpool telling me when I went to walk with him, look at the Black heritage of Liverpool. He also said to me, when you're walking through a city, look up. We tend to walk and very fixed and focused where we're going. He goes, look up, because sometimes buildings and our local surroundings tell us about our story. And if you have no idea of that story, you have no understanding or connection to your heritage within that area. And what does heritage lead to? Mental health. So there are all these small little nuances that we sometimes disconnect ourselves from that can really help us.
Oh my gosh, that's amazing. Because, and Dawn, because you're able to walk, talk, and kind of be reflective all at the same time, and even tap into your roots. You may find some resilience by doing all of that. What do you think, Dawn?
Absolutely, and it's called Black Heritage Walk Network, and it is a networking opportunity as well. When we're in a situation where we're in quarantine, we're unable to connect with people, and the only thing that you can do is walk. It enables you to network with others, share your experiences, share the past, learn from those experiences and that past, and also work towards a healthy mind, body, and spirit.
No, I quite agree. What other activities are you finding that your organization has delivered to improve health inequities, improve upon health inequities?
Shall I take this one first, Dawn?
Okay.
Yeah.
So at UCAN, as I said, because we're an anchor organisation, we were very active as soon
I'm
as.
sorry, Dawn, would you mind just saying what UCAN stands for?
Sorry, it's United Community Activity Network. So it's UCAN Birmingham. And as I mentioned, it's an anchor organisation for many different organisations with Birmingham. So we had to be responsive during COVID. So we didn't have a lockdown as such, because we weren't allowed to rest and quickly put together a community response. So there was direct support that we've done for the local citizens. So that included obviously just supporting Birmingham City Council in terms of raising awareness of COVID within the Black community, and that's through a Birmingham programme which is called Be Healthy. So we quickly recruited Black health champions that would go out into the community. These are the local churches, local groups, wherever Black people follow, so that they can dispel the myths around COVID and obviously raise awareness of COVID immediately. So that's what we did to start off with. Then there were issues around obviously welfare support. So a lot of people of colour were unable to work. They didn't have the type of employment where you'd get what we call furlough payments, in terms of support, and quickly needed help in particular food. So we did a Dishes in the Cupboard programme, which gave food bank support to those people in need, but not only just food bank support, teaching them how to shop clever and cook clever, and use the basic essential items within the cupboard in an innovative way and in an effective way, so that they're able to maximise the resources that they have. So that was a bit of education and a bit of support, and also providing hot meals for those who are unable to get meals as well. In terms of mental health, we put together a podcast which is called This Is My Lockdown. And This Is My Lockdown provided a safe space for people of colour to talk about the issues that are affecting them. So this could be issues around body image and weight gain, or it could be issues around the stigma, attached to mental health. It could be issues around cabin fever and the effects of that. And the podcast provided that safe space for people to talk about these issues. Also, we teamed up with Sport Birmingham to keep people active. So there's a Playways platform where you can upload videos, exercise videos, or live videos to keep moving. So we quickly put that on our website so that people are able to access online resources to keep moving. And then we also, remember, we have 148 groups. So we had to support the groups and support the infrastructure within Birmingham in order to, keep that healthy outcomes for the community. So this was also supporting the sports clubs who are part of our membership, making sure that they were fit for purpose to deliver services online, and also fit for purpose to market their services digitally, because that's not something they had to do before. Also, we made sure that all our members had the relevant COVID policies and procedures, to make people safe and healthy when they're delivering support. And we also put together a mental health toolkit for sports providers, so that when they do have people from our community who come to them for services and obviously to get fit, but they may have a mental health because they haven't been out for long, or they're suffering from the trauma of this global pandemic, then making sure that those sports providers are equipped to deal with mental health when they're giving advice and support, and have the capabilities to do that. Also, that we did a program which is called This Is My Career, which is about supporting individuals and entrepreneurs so that we can keep the Black businesses within the area supported as part of what we're doing, because it's very important that we had an unstable black community before COVID, so we needed to make sure that Black community was strengthened during the process.
That is amazing. I mean, you've really covered all of the process and everything that is needed to kind of sustain people during a crisis. How long did it take you to understand that you wanted to tackle the economic issue? You wanted to tackle food insecurity. You wanted to tackle fitness, mental health. I mean, with your 148 partners, did you just have a session? How does one draft something like that? And how do you get all these stakeholders? Or was it kind of an easy sell?
We just hit the ground running. We're a responsive organisation, and we're lucky that we're in touch with the community, in touch with our members. So we're able to galvanise our members, galvanise our community quickly in order to perform a response within a crisis like this. And it's quite interesting when Gary said that sometimes, communities on the ground are not recognised by, mainstream organisations and public services. And I think we proved to Birmingham City Council and the rest of the UK that community groups on the ground have the capacity to respond within a crisis and support the community.
Now, someone just asked for the URL for your organization, so would you please share that?
Yeah, so can I put it in the chat? I've put it in the chat, but it's youcanbirmingham.org.
All right, excellent, excellent. Tell us more about how you came to this whole idea that it had to be an integrated approach, that you wanted to make various levers work. And can you talk to us about how many people participated in your food bank program and your sports program? Can you talk to us about that?
Yes, so what we're able to do is work across all areas. So we work with academics, which is BCU, who's our main partner at the moment, Sport Birmingham, which is the leading anchor agency for sports organisations. We also worked with Birmingham Commonwealth Association. So a lot of the Black communities within the UK come from what we call British Commonwealth countries. So they identify with those Commonwealth countries. So by working through Birmingham Commonwealth Association and its membership, we're able to get a wider reach within the local community. And the Black community in the UK is quite wide. Obviously, yes, we've got a high number of African Caribbean people who settled within the UK, but there is growing numbers of the African community and other migrant communities, and we're able to tackle those through Birmingham Commonwealth Association. In particular, we worked with other leading anchor organisations that lead on particular minority groups, like the Bangladesh groups, Somali groups, and things like that. So we were able to bring those together through our networks and our membership. And I said, of course, we have to work with local doctors who are part of what we call clinical commissioning groups within the NHS, who lead on the services and support for the Black community. So we worked with them and, obviously our partners within the City Council.
That's fantastic. How do we improve cultural sensitivity in our delivery or in your delivery of healthcare in the Black community?
Gary, do you want to answer?
I'll take this on board so you can have a rest. No. So for us, one of the things that we've been looking at is understand, as we said, because we're community organisations, we're amongst our own people, we understand the issues. There's not many issues that we don't understand that we're not able to tackle. And what I mean by that is looking at the sensitivity. One of the things that's come to light of recent, and this is right across the board. So as Dawn mentioned, BCU, I'm actually an academic student there at the moment, an undergraduate, doing the first Black Studies degree in Europe at the moment. One of the things we've been able to withdraw from that is looking at just the simple thing of a mental health. So you go to your doctor, you tell him you have an issue, he refers you into the community to a therapist. Now, I would say probably as much as 95% of that time you're recommended to a therapist, it would be a white therapist. So we've got to understand, well, sometimes we need a Black therapist to deal with those issues that are in the Black community. Agreed? So we've got to look at those sort of issues here and say, well, this is the way that we can actually tackle this. There are some small wins. I always talk about small wins and small gains. That's it, simple. Offer the people the opportunity to see a Black therapist, and those inequalities can be tackled in a different way. They can be tackled through the same lens and prism that people are looking at and understanding, if that makes sense. And then what we also do as well is looking at social services, looking at sensitive services, is looking at organisations that offer that as well. Sometimes we're looking at the distance for something that's right under our nose. And what we mean by that is some of the services that we're offered through, there's a new system coming in called National Academy of Social Prescribing. And what that is looking at doctors and understanding doctors to prescribe people to local services that's more beneficial to them rather than just offering medication, which is normally the first tool that they turn to. So we've been using this way of looking at what is culturally sensitive. Sometimes it's not for people to actually go out and say, right, I need to do, medication to manage my moods. It may be that we recommend to them that they take a course of like African Kemetic yoga, and they use that yoga to actually use that as a kind of a service. So we've been looking at using other alternative methods of treatment as well, and being sensitive to those people's communities and ideas as well. And as we've seen recently, we can go right across the board here. A new bit of research that has come to light of late as well, talking about cultural sensitivities, is even the way of diagnosing people. It's now been, again, in some research, been understood that like just the way that people look at skin, the way that some medical issues appear can be transformed by the way that the skin, so darker skin, kind of mask those inequalities. There's been a bit of work into that. I can't remember who it is off the top of the head. So if anybody remembers, please do put it in the chat as well. But it seems just little nuances like that we're now starting to understand that we've, these are everything we look at, fibroids for women, the way that was treated for Black women was different. So, we've got to look at all these inequality, all these medical issues that arise for us as well, and understand that sometimes we need a service that is representative of us and recognised and led by people like us as well to offer those services. And sometimes it's signposting to different community organisations who might know people within that field.
Awesome. I see we're going to have to do a lot of coverage in the UK because you guys are doing some outstanding things. I mean, Black Health Matters, as you can imagine, when we cover something, it is from an African-American perspective. So like you were speaking in terms of skin color, or, there's information that says we need vitamin D, right? And maybe the more pigmented you are, the more melanin in your skin, you may not be absorbing vitamin D to the level that you need to. And there are some people who feel that, you could be more depressed and vitamin D could help. So there are certain things that you need to think about in a holistic way. So how are people responding? Because you really look at things holistically versus maybe just, perfunctory, try X, try Y. It seems like you're really trying to personalize that experience for that patient or that consumer. Can you speak to that, please?
Yeah, absolutely. And I echo what Gary was saying. It's really important to use what we call locally trusted intermediaries in terms of improving health outcomes for the Black community. And those locally trusted intermediaries may not look like what the mainstream services think would be the right vehicle to tackle or to engage with the Black community. And I'll give some examples. I mean, I think earlier on when I was talking to, when Dr. Basira Guy was talking, he mentioned that, Black people cannot dissociate themselves from faith. And, connecting with faith organisations and using faith organisations as local leaders is a really effective method. And I delivered like some mobile vaccine outreach, pop-up outreach centres, and we delivered those in local Black churches in order to, increase engagement in terms of the vaccine. And that was really, really successful. And then another different example is I'm part of a women's skating group. So it's called Sisterhood on Wheels. So it's just literally Black women skating. That's all it is. And these Black women are from all sorts of backgrounds. They're young, some are over 50, some are even older because they used to skate when they were younger in the 70s. And it's just a simple way to get people out moving. Now, our services will never think of engaging, setting up a Black skating group. It's just not the norm. So it's about really thinking outside the box and being really innovative in your approach, in order to do the groundwork, the preventative work in terms of in terms of health outcomes for Black people.
So now when you have the name of your initiative is you've included mobile, are we speaking in terms of mobility, in terms of walking, or the use of technology with your mobile device, your mobile phone?
It's more about delivering services for Black people in Black areas and going out to where Black people naturally gather. So for example, some of the challenges we have in terms of people accessing health services and support is that many Black people work different hours to the mainstream community. They may work shift work, or they may work different types of hours because of the nature of the work that they do. And so if you're invited to a health check by your GP at 2 p.m. in the afternoon, it's impossible for the Black community to do that. So having mobile health or pop-up outreach services within the community at different times, maybe sometimes weekends or in the evenings, enables people to have the essential health checks that they need to have, or the essential awareness of certain conditions such as diabetes, hypertension, kidney disease, which is accessible within their time when they're able to do it, rather than have to go at a different time. So that's what we mean by mobile. But of course, because we're now in the 21st century, and as a result of COVID, yes, we have delivered a lot of digital support, but that has also come with its issues, because what we've found is there's a lot of digital poverty within the Black community. So the first step of our programme was to make sure that our Black community are actually online or have access to mobile devices to access online services. And then about educating them so that they're able to access the range of information that's online, but also services and support online as well that's beneficial for them.
Excellent. So now, do you find that a lot of people are online or not, or no?
I
What
think
about your seniors? What are you finding?
there's still an issue, and everybody thinks yes, seniors are having a problem getting online, but we cannot get away from the fact that there is still poverty within the Black community, and some people just don't even have access to internet, access to Wi-Fi. I run a program called Eat, Walk and Learn with Gary, and I was so surprised how many people asked us for welfare support, to have a mobile dongle just to access our online program, never mind actually do the online program. So there's still a problem in terms of poverty, access to digital devices, and obviously, you know, using those digital devices as well.
And I think
That is an imperative, I know. Go ahead, Gary.
Honestly, I think we saw that as well once we went into this COVID pandemic, that we, you know, schools are automatically switched to teaching online. And then, you know, there was this sort of like, you know, oh, we could never teach online, we don't have the capacity. And we found we had the capacity to do it. But then some people, like you said, because of poverty, couldn't afford to get online in the first place. And there was this, like, you know, this gap. It was almost like a shock. What you mean you don't have internet? You know, what do you mean you don't have internet? And it's like, just this idea and assumption that we automatically assume that everybody had access to internet, everybody had access to devices, you know. So we've now got this issue with mental health within school children who weren't able to access services for the last 18 months. Now, the way that we've looked at it is looking forward. Well, what can we do with that? Well, we've tried to help deliver devices and services, and some companies have been fantastic in trying to bridge that gap. But it was a little bit too little too late in some regards. And we now have a whole generation of children that left school within that period. That's going to come back to us. We know that already. We're already seeing those, and we know 5-10 years time that is going to come back to haunt us as well. So, you know, as much as organizations were going out and identifying, you know, call it digital poverty, what we've got to do is, how do we respond as a community? How do we say, right, not only for now, not only how do we tackle that issue now, we've got to be thinking about the future. Because if these children had, you know, they didn't have a head start, you know, they're never going to catch up in this race. And it's not as if we don't have enough inequalities to deal with as it is.
No, absolutely, absolutely. We have a question in the chat. What age range of people typically support your programs?
Do you want to go first, Gary?
Yeah, so for me, I can give a very short, quick answer. Anybody, anybody. And, you know, what I will say as well, it's not even saying anybody and you have to be like, you know, fully mobile. We've adapted our programs to involve those who are less mobile as well. You know, we're looking at getting people out, tackling heritage, mental health services as well, getting people movement. And just because people have disabilities or can't walk as fast as the fastest person in the group, we're able to pivot and adapt those programs for people. So there's no reason why anybody can't do it. Whether we take an hour to do that walk or we take 2 hours, you know, we do it at that pace to include everybody.
Nice. We have
so
a comment.
Just for me to answer that question, our services and support is responsive to the actual local community and the issues on the ground. So, for example, maternity services. So, you know, we work with, you know, from pregnancy right through to, you know, to dementia support. All the things that we spoke about today are our priorities. But for me, it's not about age, it's about demographics. So men's health, women's health, services for younger people, vulnerable people and older people, those who have no recourse to public funds, i.e. migrants who are new to the country and do not know how to access services. So they will come in all ages, all backgrounds and all shapes. And that's where the focus of our support is.
No, I understand. Thank you. So we just had a comment from the chat that Birmingham City Council Library is open and they do free use of internet for 45 people, I guess people 45 or plus, or 45 people 3 times a week.
Yeah.
So that was again.
That's good to know. Yeah.
If you remember, our library services have only recently opened as well. So it's great that people can access those now, but during the lockdown, the library was closed for most of the best part of the period as well. So, you know, it's about signposting people to this information as well, but also, as you said, the library wasn't available through the COVID pandemic, so people weren't able to use that particular service.
And there goes, you know, the issues in terms of access to services. So our library is based in the centre of Birmingham, and to actually get to the centre of Birmingham may require, you know, catching public transport or a taxi in order to get there. And if you're already in poverty and you can't afford access to internet, then you're unable to get into the centre of Birmingham in order to access the free support that's available within the central library. And this is exactly why we need mobile health outreach and mobile services so that we can deliver that support in people's neighbourhoods on their doorstep.
Essential. I mean, that is so much of what has to happen, right, is bringing it to the people versus expecting the people to kind of come to it.
Absolutely. And that's a classic example.
Just have to, we just have to be committed to knocking on those doors. I know for us, when it was apparent that we weren't going to be able to meet live any longer, we used to have our summits rooted in the Black community, and people could come and spend the day with us. We provided breakfast and lunch, so they didn't have to leave for anything. We even had medical screeners. And so when we weren't able to do it, people would call us and say, "We understand you're canceling. Why?" And, we were surprised that the interest was just that strong. And we had to say, well, there's something called COVID, and it's not but good. It's good. It's not, it's going to be harmful for people. And we're understanding it could actually kill people. So we're not gathering in mass any longer. And the remarks were such that, I'm glad that I know, because I would have spent my car fare to come. I would have, used my ticket to come, and there wouldn't have been a service, and that would have been a problem for me. And, you or I may think we lose our car fare and our sofa cushions, and it doesn't really impact us. But for many, it's a big decision to make that, trek, or to try to seek out services like that, and get on trains and whatever you have to do. But now mobile is the way that helps to connect us all. But if we look forward where we can get out and start to talk to people and touch people in person, even in 2023, 2022, we're looking forward to doing that. But now, as you're sharing, mobile is key, and we all wish that we're going to start knocking on doors as soon as possible. Was there anything else that you wanted to share that we did not cover?
Only that myself and Gary, the reason why we called it Mobile Health Outreach is we're going to continue this discussion and continue to deliver innovative programs and work with local partners to increase the access to mobile health outreach within the Birmingham area. And I don't know if you want to elaborate on that, Gary?
Yeah, so one of the things that we're looking at with the services is we've actually created a community bus, or we're going through the process of creating that community bus to provide a Black-led service, as Dawn keeps mentioning, about going out into the community. And one of the things that we want to be able to do is allow people to come to this particular, wherever we set up, access the services. The bus will have internet and information like that, but it's really about signposting and for people to get on board with the information that we're trying to share. I think it goes back to at the beginning, I talked about sometimes some of our simple solutions are really about just sharing knowledge and information. A lot of the stuff, the health inequalities we covered, diabetes, it all links, so it creates this like life cycle. So diabetes, what did it say? You're overweight. What do you need to do? Lose weight. How do you do that? Walking. Who does that? Black Heritage Walks. What else can you help with me? Well, let's signpost you to, mental health services, should you require them. And then, we come back full circle. Where do we start? And you talked about technology earlier. There's something that I wanted to sort of put forward as well. So just to show how the service works. So recently there's a medical company that put forward a device that helps people to track their diabetes just by scanning your phone onto this particular piece of software. Now, it's an amazing equipment. I've seen it working live as well. It's absolutely brilliant. And here comes the problem. So if your doctor doesn't recommend it to you, what they'll do is say to you, well, it costs you £95 a month. Now, this device is actually life-saving, but it's so expensive. And within the community, people really can't afford that. I know in the States, you have a different way where you even have to pay for insulin, which we get on our NHS here. So there's a slight differences as well. But it's also going out to the community and telling them there is a way for them to be able to get that piece of equipment, which can be life-saving. And in the long term, it's actually cost reduction for doctors, but they don't see it as that way when they're looking at budget. But if we can educate more of our community to go and ask in the correct way to approach the service to get this device that is life-saving and will help them, but not on the economic front, we've got this amazing tool that's amazing that we can actually do some real good with that. And it's understanding that once we create a package that's on that bus where people can come and visit us to find this information, that's what we would see as an amazing win for mobile health outputs and outreach, sorry.
Absolutely. And like with our mobile health bus scheme, it enables us, as I said, to be in local neighbourhoods on your doorstep at any time. We can just park the bus as long as we've got the space. And we can be there at weekends, evenings, at times when people want to access services or are able to access services. And it also allows us to better engage with local health practitioners and to showcase Black health practitioners within local neighbourhoods so that people can see that services and support are delivered by people who look like them and understand them as well.
That is so important. Well, please, if Black Health Matters here can do anything, and we're happy to join. And again, we are a reference guide. We've got more than 1,500 pages of content relating to healthy lifestyles, how to live it, and it's all self-reflective. So it's very uplifting. So please think about including us in as you share information with all of the wonderful people that you're working with and helping in Birmingham and beyond. And this is our close. We thank you so much, Dawn and Gary, for
Thank
this
you.
great discussion. Keep up the good work. It's so exciting and so inspiring. Take care. Have a great day. And
Thank you
congratulations
very
on a great
much.
summit.
Bye. Take care.
Bye.
Bye-bye.